Hi there, my name is Cassandra Babcock, and I am currently taking the course 612, the role of Epidemiology in Healthcare Administration, through the program Masters of Healthcare Administration at Touro University Worldwide. Today is currently December 7th, 2023. So, what I'm going to be focusing on today is mental health for low-income communities. So we're going to start out with the definition of epidemiology, which is the study and analysis of the distribution, which is the who, when, and where, and the determinants of health and disease conditions in a defined population. So with that definition, the first thing we're going to look at is social determinants of health, which is in the CDC in 2022, it states that social determinants of health are the non-medical factors that influence health outcomes. This can be things such as a person's environment, cultural background, religion, age, basically anything a person believes, how they've grown up, genetics, and the place where they've been, and all living. These affect their health and the choices they make. This can be like certain religions may not want someone to get a particular treatment or procedure based on their beliefs, or this could be the access to healthcare, if they're even able to receive healthcare, insurance. All these extra factors are social determinants of health. As we see this informational graphic, it just shows what they think the percentages of are that affect it. However, we're not going to be focusing on that. We're just going to be focusing on certain social determinants of health. The ones I'm going to be focusing on are education, housing, and genetics. First one we'll look at is genetics, which is basically a person's makeup. I personally have genetic makeup for mental illness, as my grandparents had anxiety, my dad has anxiety, and I have anxiety all at the same time. Because of this, we can see that maybe my children in the future, I should be ready for them to possibly receive some form of therapy or other interventions to stop it in the future, which is a good thing a social determinant of health can help influence in terms of genetics. However, we're also going to be focusing on housing and education. So the education market in Oregon is very interesting, as we usually rank in the 30s in terms of graduation rates. However, in the early 2000s, we ranked in the 40s, so we've made an increase. However, in 2021, the Senate Bill 744 was passed, which temporarily suspends the requirement for students to demonstrate proficiency in essential skills, such as reading and math. So this means that standardized testing and other testing procedures in any way in school don't necessarily need to be needed for a person to graduate. You may not even be able to read, but if your teachers pass you the course and you get your 24 credits to graduate, you're able to graduate. So no testing is really needed. And this will continue until at the earliest 2024. They will possibly look at it and make a decision on if they will extend this, if they will make it permanent, or if any other changes will occur. This can be very detrimental to many people, as lower income do not have the resources to be able to get higher education, which could be into college and other things like that, but also could be private education, just private schools while they're still minors. These can affect mental health, as of course, if you aren't able to process certain things, if you aren't able to bring yourself into the world, it may affect it more than others. Housing is also a big thing that is problematic when it comes to Oregon. So the Oregon Department of Emergency Management has enacted homeless executive orders. So this means that impacted areas, which is many of Oregon counties, experienced an increase in unsheltered homelessness of 50% or greater since 2017, and it did increase in 2022. This will continue to take place until, again, 2024, before they go and see if they need to continue this emergency, or if they need to stop it, change it, or do anything with it. Homelessness is a very big factor in both low-income families and those within the poverty line, as well as those who have mental health, as they may not have the resources, access, or to even be able to go towards that. So when we look at low income in general, The Assistant Secretary for Planning and Evaluation, which is the principal advisor to the Secretary of the U.S. Department of Health and Human Services, states that in 2023, the poverty wage for one person was $14,580 a year, $1,215 a month, and increases based on the amount of people, which is in this left infographic. The right is in 2018, but it is a pretty good idea on what Oregon is currently facing in poverty statistics, which does influence education, housing, and similar things, which then in turn affects mental health. So if I were to want to make a design based on this, I'd go experimental. Observational would be great based on this being low income, so we may not have the funds. However, to be able to really get into depth, especially within mental health, we need medical records and other sensitive information. So we would need authorization from participants to be able to get those records and be able to get their information to be able to see what we can do, what can be done, what the statistics are, and everything in between. This can be getting there if they've graduated from high school, if they've gotten a GED, or if they haven't. We would need some information that we need to know if they are lower income. So do they have pay stubs? Do they have tax returns? Are they working? Things such as that. Are they on disability? We would need to know if they have a medical diagnosis for a mental illness. And if they do, are they seeking treatment? Are they getting medication? Are they getting therapy or any other means? It's illegal to collect data without their authorization when it comes to medical records and sensitive information, so it would need to be experimental. We would also want to see if they have housing, see if they're on low-income housing, because Oregon has programs which give money to those who need Section 8 housing. We would need to do more social determinants of health. We would also need their genetic background and their families. So what makes their genetic, that is a study design that is very long, very in-depth, but it would be a great way to see how low income is being affected in terms of mental health. That is what I have today. And I hope you enjoyed it. And I hope everyone has a good day. Bye.